Across the Desk
with Clement Manyathela
on 702.
And on our Across the Desk feature this morning, I'm hosting dermatologists, and I've invited them so we can find out more about the work that they do. What's the most challenging thing? What's the most rewarding thing? This is what we do with our guests who come on our Across the Desk feature from all the different professions we've hosted on the show before. So let me introduce you to my guests this morning. And remember, you're welcome to join this conversation. You can call if you've got a question. Maybe you are in the industry yourself and you want to share your own experiences. You can do so by calling us on 011-883-0702. The WhatsApp line is 072-702-1702. We've got Dr. Irshad Essack, who is a dermatologist, here in studio with us. We also have Dr. Ayesha Omar, also a dermatologist. Dr. Essack and Dr. Omar, thank you so much for coming through. Good morning.
Good morning. Thanks for having us.
Good morning. Thank you for having me.
So, I always start off when we do Across the Desk by asking my guests, how did they become what they are today? So for you guys, have you always wanted to be a dermatologist growing up? Did you even know what that is?
I did. Funny enough, my dad is a dermatologist. So he played a big role as a mentor in my life. And it seemed like a very, like a sort of easier type of a speciality to be in, being a mum with children at the time. So that I played a big influence in a role in decision making for me.
Was there anything though that influenced your decision later on? Like, what was it that said to you, actually this is what I want to study? Did it fascinate you then when you were young?
It did fascinate me, but I think being a mum with two little children working as a doctor, I needed to, I was looking for something that would be easier to bring up my kids and enjoy the profession without having the grueling after hours and not being a slave to the profession, but rather enjoying it and giving back to my patients, but also my family at the same time.
Yeah. And for you, Dr. Essack?
If you ask me as a child, my response would be, I didn't think of becoming a doctor in the first place. Somehow I entered into medicine, and even through my undergrad training, I didn't actually pay much attention to dermatology. Dermatology was relatively a smaller portion of our undergrad training, and I didn't really pay much attention to it as a speciality. And even post community service and into private practice, I still at that point in time had my sights set actually on pediatrics. And I had joined an academic institution, and I did a fair amount of pediatrics. And as Ayesha was just mentioning that you also want to look at your quality of life in terms of you as a doctor and a person who's a member of a family as well. And pediatrics was quite time consuming, although I enjoyed especially the neonatal part of things. And I left pediatrics with the promise that if I missed that space, I'd come back one day. And in the time that I'd left, I found myself doing a fair amount of internal medicine at the height of the HIV epidemic. And a fair amount of the patients I was seeing were coming over to us with rashes. And I began to interact with the dermatologists at the academic hospital and trying to find out, well, can you help me? Can you help me? And eventually what happened was that more as a matter of, here's a textbook, go off and read something and make something of yourself. Because I was annoying them on a regular basis. I began to read dermatology textbooks long before I even entered into dermatology. And then I realized that I'm actually enjoying this. And pediatrics is something that I maybe not want to go back to because of the emotional demands of pediatrics, especially at the height of the HIV epidemic.
Yeah. So there are some people who think, when you go see a dermatologist or they're thinking about skin, they're thinking, that's just cosmetic. Can you explain to us, Dr. Omar, what a dermatologist actually does and how your work differs from just general practice? Because, you guys deal with a lot more than just, your acne or pigmentation disorders. There's bends and skin cancers that you look at. Just help us understand what the work is all about.
Yes, correct. A dermatologist covers a wide range of skin conditions. 90% namely hair conditions, skin, nails, mucous membranes. We treat adults and children. We deal with pigmentation problems, alopecia or hair thinning, skin cancers and moles. Any growth or any lesion, definitely we treat. So a very wide variety. Things like acne, eczema, psoriasis. We also deal with the cosmetic and aesthetic concerns as well. And dermatologists are trained to combine surgical and aesthetic techniques. So we want to enhance and get the patient to the best possible version of their skin. We treat the medical problem and then we try and improve them to the best version of themselves as well.
I suppose the thing is, some people see it as a luxury. I mean, I was reading a report from 2019 of how many dermatologists we even have in the country, especially in far-flung rural areas. What do you think about that view that, you have to be financially at a different level for you to be able to have access to a dermatologist, and it's not as accessible for people in the rural areas?
I think there's a lot of truth in what you just said, in the sense that if you look at in South Africa, members of the South African Society for Derm Surgery and the South African Society for Dermatology, there are only about 350 registered dermatologists at the moment. Now that's for a population of more than 60 million. So when you say access, there are very few of us who are able to provide services to everyone. Now, the main reason why I think the majority of dermatologists are in urban areas is because at the very heart of it, we are still medical doctors. We are medical specialists. So we still rely largely upon auxiliary services, laboratory services, radiology services, referrals to and from other physicians, cardiologists, rheumatologists, and they are also very much in the urban centers. However, the thing that makes dermatology a little bit more unique and amenable to is telemedicine or teledermatology. So in as much as we may not be physically accessible to many patients, there are many platforms, either through organizations or through certain websites, whereby we provide dermatology services to the best of our ability according to that telemedicine circumstance, where we can provide, for example, the primary healthcare nursing staff at far-flung areas of the country, where they can send us photographs, and we try our best. Yes, there is a limitation where you don't have the luxury of a face-to-face consultation to be able to touch and feel the lesion, but you certainly can, in most cases, give them some sort of guidance as to whether to use a cream that you may have in your essential drug list cupboard at the local clinic, or is there something that concerns us a bit more for them to then refer the patient to a district hospital or a regional hospital or tertiary hospital. So we are at a disadvantage in the sense that there are so few of us. And there are many, many people who would like to do dermatology and are coming across as dermatologists, but unfortunately they can't provide the same sort of level of medical service that a dermatologist actually provides.
Mm-hmm. Are there specific skin conditions, Dr. Omar, that you see most frequently in your practices? Like, is there a trend that you're picking up?
Yes, I think our normal bread and butter is acne, eczema, psoriasis, pigmentation problems, very across board, and skin cancers and moles in fairer skin people as well, as in all phototypes actually, all skin colors. So these are the usual concerns we see on a daily basis in our practice. And then obviously there are other conditions that are not as common. We see in babies skin problems when they're born or through childhood. You can get very rare things where they're born with complete peeling of the skin or blistering conditions, where they'll need an expert opinion. The pediatricians and the neonatologists would call us for that, which I see all as well. And then in the adult or older patients, you see also skin drug reactions to certain medications when they're on multiple drugs, also blistering diseases. So I see a wide variety, but these, what I mentioned, are usually what I see during my week at practice.
Okay. What would you say are is the most challenging thing about the work you do?
I think the most challenging thing is that you need to not just see the skin in isolation. I mean, the popular comment that most people make is that the skin is the largest organ of the body. Yes, that's true. But I think what people forget is that it is what presents us. What your skin does for you, it actually gives you your identity. And I think as South Africans, we know very much about how your skin and skin color can make a large difference in how you are viewed and how you are judged. So what we don't realize is that your skin is very instrumental in how your life actually pans out. Whether you've got acne that's got scarring, it impacts on your self-confidence, it impacts on your self-esteem, it impacts on there's studies to show that it impacts on your employability and your ability for you to actually be gainfully employed. So the skin essentially is a window into the rest of the body. So coming back to dermatology as a whole, us as doctors, we are dealing with the skin as an organ, but it is an integrated organ with the rest of the body. So we do not see the skin in isolation. So it's skin in the context of cardiac disease. It's the skin in context with renal disease. It's the skin in context with psychiatric disease. We see the skin as one window into everything else. And if you are only seeing the skin in isolation, you will miss the fact that the patient may be having other medical problems. So I always say that, for people always tell us, well, we're not really the heroes because it's just a rash. If it's dry, you wet it. If it's wet, you dry it. And if you're in doubt, use a steroid. But it goes way beyond that. That's the fact of dermatology. I may not be able to save you from your heart attack, but that's not my job on a daily basis. But if you come to me with certain skin conditions, and if I have the index of suspicion that you may be having cardiac disease, where there's a problem manifesting on your skin, or a kidney disease, or a rheumatological disease manifesting on your skin, I could be the one who's going to point you in the right direction, put you into the hands of another specialist colleague who can assist you with a more life-threatening problem.
And the most rewarding?
I think to see patients' improvement in overall quality of life. Be that a little child who's battling with some sort of blistering disease, where you can assist the child, thereby assisting the mother and assisting the parents. Whether it's a problem with, and children do get skin cancer too. So whether it's a child, for example, with albinism, or a child with a blistering disease, where you are giving advice to see that improvement in quality of life. And I think for me, when it comes to children, maybe I just got a softer spot for them because I always like pediatrics. The thing that we very much underestimate is the debilitating capacity of an itch. We don't realize that. And if you've got a 3 or 4 year old at home who's, for example, scratching themselves to death from an eczema, that child who's scratching will disturb their sibling in bed. The sibling doesn't sleep. The child doesn't sleep. The parent doesn't sleep. So the next day, the older sibling then has got a problem when it comes to their productivity at school. The parent hasn't slept the whole night. The next morning, they are troubled at school, at work. They can't be productive. And the poor child themselves may be subjecting themselves to infection. So when you are able to change that, and you may just be looking at it from a patient point of view, but you have a positive impact on the entire family.
Dr. Omar, what about you? What's the most challenging thing about being a dermatologist, and what's the most rewarding thing for you?
Okay, so I'll pick up where Irshad left off. I agree with what Irshad is saying. You know, when I treat my little eczema patients, being a mother also, I'm very empathetic towards children. And on that first visit, covered in bandages with a bad odor, and the mum in tears, helpless, they don't know what to do next. The oversupply of products on the shelves, they've tried everything, exhausted, sleep deprived, financially, it's just too much and an overburden. But just simple techniques, simple advice, a little bit of a start and a plan, and one can improve them dramatically. I mean, the little girl made me a little beaded bracelet and she dropped it on my desk. She gave me a hug.
Oh.
And that was just enough for me. My heart warmed and I said, actually I am making a difference. We doubt ourselves often, but small things make a huge change in the quality of life, in the impact in that child. They can go back to school. Their friends don't pick on them anymore. They're not scratching with rubbing their eyes, peeling skin. It really, these are huge things in an individual. Whether it's a child, an adult, it affects everybody.
There's someone who asked earlier on Twitter that, Clement, please can you ask the dermatologist there, is it true that when you drink water most of the time, then you're going to have good skin? Because I also feel like our parents told us that because they just wanted us to drink water. But is there a correlation between drinking lots of water and your skin being top tier?
Definitely. So, often patients will say to me, but doctor, I want skin like yours. And I'll say to them, it's not just about what you're applying on your skin. It's everything around you. It's what you're eating, what you're drinking, the exercise, the sleep, the stress. All of that plays a role.
Also?
Definitely. It all plays a role. Your lifestyle is crucial in determining what your skin is. And yes, you'll see patients, they'll tell me, oh doctor, in the winter time, I'm lazy to drink water. But you'll notice the dehydration, the sunken eyes, the sort of wrinkled skin, and just small little changes can make a huge difference in your cosmetic outcome in the patient.
And Dr. Essack, we always obsess mostly about what we apply on our skins because we think that's the solution. But water, exercise, and all these other things.
Clement, you exclaimed it just now when Ayesha mentioned exercise. But think about this from a physiological point of view. When you exercise, you increase blood flow to your skin. And your skin plays an exceptionally important part in thermoregulation. You don't want to be overheating through any sort of environmental stressor of heat or when you are exercising. The other thing that your skin actually does is your skin basically sweats. And 1% of overall waste from your body is eliminated via your sweat. But coming back to the exercise, you'll find that increased blood flow will bring increased oxygen to the area. So from a wound healing point of view, from a disease healing point of view, you improve the skin overall. So the skin has got a very large vascular reserve. And you'll find that when you exercise, you're actually feeding that reserve from an oxygen point of view when you exercise.
Okay, at least that part is covered for me because I don't drink a lot of water.
But we know that you run a lot.
I don't like water. But I run a lot and I exercise a lot. I'm trying to drink as much water as I can, but I've always been that child growing up. What about washing your face with cold or hot water? Because that's also a debate we often have with friends. Like, is it like some friends are like, why are you washing your face in the shower with hot water? It must be with cold water. Does that matter at all?
Okay, so as far as the hot and cold water debate is concerned, I think it's very much what the individual is comfortable with. I think more importantly than the temperature of the water, but temperature of the water will certainly impact in certain disease conditions, for example, like eczema. If one is more eczema prone, the warmer or hotter the water that you're using to bath or shower with on your skin, you'll find that the evaporation and the loss of water through the skin will be exponential the warmer or hotter the water is. So, for example, in an eczema patient, we'll tell them to use as lukewarm water as infrequently as possible for them to have a bath or a shower. But I think more importantly, from a hygiene point of view or from a skin health point of view, it's not so much the temperature of the water, it's more what you wash your face with. And that boils down to your cleansers. And if you are using harsh cleansers, those that tend to foam and bubble a lot, those have got surfactant properties to them which tend to strip natural moisturizers that your skin produces. And you see there's a lot of this song and dance on social media at the moment about replacing elements in the skin like ceramides and squalene and that type of thing. There are lots of products that are out there at the moment, and they are very much focused towards repairing the skin barrier. And harsh cleansers, what they do is they break down that skin barrier. When they break down the skin barrier, many things happen. One is exacerbated water loss. And the other thing is that you then allow bacteria, fungi, viruses, germs that generally live together with you on your skin. They didn't get the chance to get into the skin, and they also drive inflammation. And that is essentially the initial first steps of most pathological disease on the skin. So when you have cleansers that actually break down the barrier, that becomes more of a problem. And overwashing is also a problem. Because every time you wash, I mean, some people will tell you, well, I think I've got blackheads, and blackheads may be as a result of me not washing my skin because I've got these black dots on my skin. So overwashing tends to further accelerate the breakdown of that particular skin
How do we
barrier.
determine overwashing though?
So ideally, in most cases, twice a day washing with a bland cleanser is more than adequate.
Okay.
I just want to say something. If my teenagers wash at all, that's also good, because some of the guys, the boys especially, don't wash at all.
Those-
So just get water on the face.
That's true.
That's it.
That's good
In
enough.
and out. That's funny. All right, we're going to get the latest in Eyewitness News headlines. When we come back, we'll continue this conversation with my guests. I'm hosting dermatologists on Across the Desk this morning. We've got Dr. Essack, we've got Dr. Omar as well. I've got your questions coming through here on the WhatsApp line, your calls as well. So after the latest in Eyewitness News headlines, we'll come to your calls on 011-883-0702, WhatsApp's on 072-702-1702.
The Desk
With Clement Manyathela.
on 702.
25 minutes before 11 o'clock on our Across the Desk feature this morning, I am hosting dermatologists. We've got Dr. Essack and Dr. Omar, and they've been telling us about their work in this hour. But I've asked you to also join this conversation if you've got a question for them, if you've got some inputs, or maybe you want to share your own experience. Maybe you're in the industry. You can send us a message on 072-702-1702. That's our WhatsApp line. You can call us also on 011-883-0702.
Morning, 702. This is Kamo here from Johannesburg. Yes, interesting topic from 702, dermatology. One of the things that I've noted fundamentally is that people don't realize that the skin is actually the biggest organ in the human body, and it performs a lot of functions. But they only go to the dermatologist when there's something that is visually not appealing. And I think my question is, should people be going to dermatologists irrespective of skin problems or these things that are visually not appealing, because that's what prompts them to go to a dermatologist? Are we supposed to be going to a dermatologist annually just to do a checkup, or what would you recommend? You know, because I think the dental industry now has really campaigned to say, don't just come to the dentist when you need a filling or when you have a rotten tooth. You need to check your dental hygiene at least once every 6 months. So is that something that we should be doing as well to just prevent more than just be reactive, because we've got acne and all types of things like eczema?
Wonderful. Thank you for that. Thank you for that question. So how often should we visit a dermatologist for regular checkups?
I think it's a very broad question. It depends, right? So if one has a rash or a skin lesion, a new growth or a mole, I think that's very important that you seek the help of a specialist dermatologist, because this is what we trained in, to identify, treat. If it's just a general skin concern, like you can also see if it's something that you're dealing with, like mild acne that you've had for some years, or eczema, that can also be treated by your general practitioner. And if they feel they need to refer and the patient has complicated, or they can no longer assist the patient, then they will seek the help of the dermatologist to assist them in treating the patient.
If I could just come in there, Clement, if you've noticed it, have it checked out. And what I mean by that is that the advantage that we have is that you can examine, or you can take a look at your skin. You can't take a look at your heart, you can't take a look at your kidneys. But the important thing is that if you see something that doesn't look like go off to a dermatologist and have them take a look at it. Whether it's a rash, whether it's a new growth, you should have it checked out. And when it comes to people who should be having, as the caller asked, regular screenings. So if you've got somebody who's got a family history of skin cancer, particularly non-melanoma or melanoma skin cancer, I think it would be worthwhile that you have yourself at least examined once, and then once a dermatologist takes a look at you and decides whether you are somebody who is further at risk, then follow that dermatologist's advice in terms of frequency of further surveillance and screenings.
Okay. So must you then approach dermatologists if you've picked up that there's a problem, or would you advise for just regular checkups, like once a year, even if you haven't picked up anything, or rather wait for something? If you pick up something, that's when you should come.
I think most people would be probably engaging with their GPs on a regular basis for their coughs and colds and their hypertension and diabetes and that type of thing.
Yeah.
So if there's something that looks abnormal, bring it to the attention of your GP, who would probably then refer you to a dermatologist. Okay. Bearing in mind that some medical aids and funders require you to come via a referral network of a GP. But you are more than welcome to approach any dermatologist directly. The thing about the GPs as well is we also encourage them that when they are seeing patients for other problems, is to keep their eye out for potential derm problems and refer those patients earlier rather than later.
Yeah. Okay, we've got a number of voice notes that have come through, so let's play some more.
Good morning, Clement. Find out from your specialists if they can also treat warts on a permanent basis. Warts are meaning these growths on the skin, especially in the face and on the neck. I have done this procedure some many years ago, but I see they grow up again. They grow out again. Thank you. Tabo.
Good morning. When it comes to dermatology, I would really like to understand what causes pigmentation or hyperpigmentation, because I've noticed it's also prominent according to which side of the country you come from. Most of us who come from the northwest, especially on the outskirts of the borders to Botswana, as well as closer to that side of Namibia and the Northern Cape. Most of us who are light-skinned have a tendency of developing hyperpigmentation, especially from the age of puberty upwards. Then we develop very severe hyperpigmentation, which later on goes unsolved.
Well, thank you so much for that. We'll come back to some more WhatsApp voice notes, but there were two questions there. Take your pick.
Okay. With regard to the first question, a face-to-face consult is always ideal before we even give any advice. But with regard to warts on the face, I think what the gentleman is alluding to are things called dermatosis papulosa nigra or skin tags. And these sort of things, unfortunately, do come up with age, with friction. Genetics play a role, and can also come up on sun-exposed areas. And also, with regard to skin tags, usually can come up in patients who sort of increased a little bit of weight and have other issues going on internally. We are trained to remove these kind of lesions, but bear in mind that they will recur, and it's an ongoing treatment that our patients visit us for regularly. So there's no permanent solution, unfortunately.
I think sticking with the first question about warts, I think it's most important that the diagnosis is made correctly. As Ayesha just mentioned, many things can resemble warts, including dermatosis papulosa nigra. So in that particular case, it's not really an infective process, whereby warts themselves, by their very nature, are a viral infection. We had a discussion on 702 a few weeks ago. So that's actually a viral infection caused by human papillomavirus. Assuming that the diagnosis is correct, you must remember that some people are and will always be prone to the development of new lesions. So when the gentleman asks, can it be treated lifelong or once and for all, the chances are that they are going to recur at some point in time. But always bear in mind that there are multitudes of modalities of treatment for warts, ranging from procedures to non-procedures and topical treatments. So there's many, many, many options. Coming to the second question about pigmentation. I'm not sure how many hours you've got on your show, Clement. We can talk about pigmentation. Because the problem over here we're having amongst dermatologists is that everyone thinks that pigmentation is a diagnosis. Pigmentation actually is a sign. It's a sign of something not being right in the melanocytes, which are the cells that produce pigment to the skin. And there's a variety of reasons as to why these cells produce excessive pigment, ranging from excessive sun exposure to genetic factors to hormonal factors to inflammatory factors. And I think that there are too many people out there at the moment who think they are pigmentation specialists. There are people who are not dermatologists who are trying to move into this treatment space because it is so lucrative. And in terms of pigmentation treatments, I was actually doing some research, putting together a presentation for a drug company about 5 or 6 weeks ago. And I was looking at just the available topical treatments for the treatment of pigmentation. And I came up with a minimum of almost 23 on the market at the moment. So everyone thinks that pigmentation is a one-size-fits-all melasma type of situation, and anything that's purchased from a pharmacy, over-the-counter item, non-prescription item, dermocosmetic will do the trick. But it varies greatly from patient to patient, and if a diagnosis for the underlying pigmentation is not made, the chances are you're most likely going to end up spending a lot of money on treatments that are going to fail, one. Or alternatively, you're going to find yourself in a situation whereby you're going to be in the hands of someone who doesn't know what they're doing. And you would have dropped a lot of money and not having any effect. In fact, I had a colleague yesterday, someone that Ayesha does know, where the patient basically had something called a nevus of Ota. And a nevus of Ota is a type of birthmark that occurs mainly over the temporal area and the lateral part of the face. It's a type of birthmark. And this person was in the hand of a so-called pigmentation specialist who was not a dermatologist. Had been using a whole host of topicals, laser treatments, and a whole host of other things. But that birthmark is not going to move from a topically applied pigmentation treatment you're going to buy for something like melasma. There are also invasive modalities that we use. There's laser treatments, there's microneedling, there's chemical peels. But everyone currently feels that because the skin is so accessible, I can jump right in there and I can treat the patient as a dermatologist. And in the majority of cases, patients are not diagnosed properly, and you'll find that they are suboptimally managed, and essentially there's a lot of disappointment after 6, 8, 10 months of attempted treatment, and 40, 50, 60,000 rand down the line, no improvement.
Yeah. Someone else wanted to know about, says that their daughter wants to be a dermatologist. Any advice on what to study?
Okay, so I get that a lot at work, actually. Once I've treated my patients, they think it's a very glamorous job.
They want to be like you.
And they want to be, so they say, oh, doctor, I want to be a dermatologist. What does this entail? And when I start explaining to them from the beginning that you need the requirements of becoming a doctor, 6 years of getting your MBBCH degree, qualifying as a doctor, and then 1 year serving the government as an intern, which is you at the bottom. You got to do all the hard work, clocking patients, all the procedures,
and be on call.
And be on.
Our doctors
Those
always
calls
say,
don't end.
"I'm on call." I'm like, "You're on call almost every weekend."
Correct.
Because you've just finished studying, so you need to do that 1 year of service.
So it's 1 year now it's 2 years of internship actually, and then 1 year of community service, which is probably going to be in a rural area, serving the rural community.
Do I have to go to the rural area?
It can be quite fun, actually.
Okay.
You know, the saying at Wits, at Paraguanas was, you see one, you do one, you teach one.
Yeah.
That's how it goes.
Yeah.
And after your community service, you're now going to be teaching. So you're going to be the guy doing and teaching, and that's it. So, and then you qualified now, and you've got to go out there and find a job or continue pursuing your career and your dream. So you're going to engage in a lot of training and expertise and trying to do research and involved in improving your CV. And it's a very lucrative and sought after speciality. So there's hundreds of applicants. So you're going to be attending multiple interviews, being disappointed time and time again that you were not the candidate of choice. And at the same time working in government, rheumatology, internal medicine, doing calls, attending academic meetings, research projects, and so on. And with luck and time, you eventually get in. And then that's 4 years of specializing in also a tertiary hospital, on call, attending academic meetings, involved in research project again, completing a master's research project, and then you qualify as a dermatologist.
So just
It's almost 10 years.
Marathon, yes.
so just to kind of echo what Ayesha is saying very quickly. In order for you to call yourself a dermatologist, and the word dermatologist is somebody who practices dermatology, and dermatology is a specialized branch of medicine. And I think the public needs to understand that this is not synonymous with becoming a beauty therapist. This is completely different ball game. So should you want to become a dermatologist, at the absolute minimum, you need to finish your undergrad medical school. That's 6 years. Like Ayesha mentioned, internship and community service. That only enables you to register as a general practitioner. Thereafter, you in most cases need to attach yourself to some sort of academic dermatology unit with an accredited registrar training number, which then requires you to train for a minimum of 4 years in that academic environment, doing dermatology and dermatology only. You don't do anything else. Majority of us who ended up in dermatology have had the need to go, prior to getting into dermatology, to do other specialties, related specialties. Internal medicine, pediatrics, rheumatology are all related. And then only do you have to write at least 2 examinations, a part 1 and a part 2, whereby part of your examination is internal medicine as well. And when you get your qualification of either a fellow of the College of Dermatologists or a master's in medicine, can you register in the category of dermatologist at the HPCSA? Then you can call yourself a skin specialist.
I see. Oh, it's quite a journey. It's 9 minutes before 11 o'clock. Silati, I see you. I'll start with your call after the break.
Across the desk
With Clement Manyathela.
on 702.
5 minutes before 11 o'clock. Silati, you're calling us from Joburg. What's your question? Good morning.
Good morning, Clement, and welcome to your guests as well. Here's an interesting one. There's a lot of aesthetic clinics popping up, and one of your guests alluded to it. What are the long-term effects of IV drips on the skin? Because everybody's going around saying, I want the glow, I want the glow. Do you know what I'm saying? And the skin, as one of your callers said, says the skin is one of the biggest organs in our bodies.
Yeah,
so,
great.
effects.
Yeah, great question, Silati. They'll respond to that in a moment. Here's a WhatsApp voice note that's also come through.
Hi, Clement. The dermatologist, I just want to know the opinion. We like facials as ladies. I hear there's kind of different facials, like your microblading, your peel. Do they recommend that ladies do such? Because some of them have chemicals on their skin. Would they, as dermatologists, recommend that ladies get such treatments with the
Hi, Clement. Please can you ask your guests what their opinion is on where skincare therapists fit in when it comes to skincare? Because sometimes I find that dermatologists and skincare therapists are sometimes at odds with the advice that they give. Do your guests think there is a place for such therapists? This is Sidi.
Oh, thank you so much, Sidi. Great questions. We've got about 1 minute and 30 seconds.
Okay, so I'm gonna take question 1 and 3 together.
Please, yeah.
Regarding the aesthetic clinics. I think a lot of people are engaging with beauty therapists. There is a role for them to play in overall skin health and skin care. However, a lot of people are masquerading as dermatologists. My advice to the public is that if they're going to be engaging with these so-called clinics, and I'm going to use the word so-called clinics, because there usually is not a doctor or a dermatologist involved in these. Please make sure that you understand and know the qualifications of the person you are engaging with. Not everyone walking around in a pair of scrubs is a dermatologist. That's very, very important.
And the question about IV drips? What? Or facials? Was it facials?
Facials.
Yes.
Yeah, look, there are a place for facials. We as dermatologists supervise and employ beauty therapists in our practice. So we do supervise and encourage these kind of procedures, which are excellent in terms of maintaining and managing beautiful, healthy, acne-free skin. But again, you empower yourself, know what treatments you're going for, and understand the complications, and also to please consult with a dermatologist prior to undergoing these kind of treatments to see what is most appropriate and tailored to your type of skin.
Yeah.
The IV drip question.
Yeah.
At this point in time, there are many, many, many IV drip therapy bars that are popping up all over the place. Even in your local mall, you can find one. The thing is that a lot of times there may be benefits from a skin point of view. However, when it comes to the ingredients that are inserted into the drip, some of them can be a problem. And I know that one of them are glutathione, which is used mainly for the so-called glow drips. There have been reports of deaths on IV glutathione. And the people who are using them may not be aware of this. The Derm Society has frowned upon this, and majority of the times the people who are doing these things cannot resuscitate a patient.
Yeah. Oh, please, guys, be cautious out there. Dr. Essack and Dr. Omar, thank you so much. This has been so informative. Really appreciate your time.